we were able to come up with this strategy of me taking a day or so a week out of my private practice and being a part of the team at the Integrative Health Center. So it turned into, way more than I ever imagined. Not only did it provide me with a platform to work, in the spirit of the doctor of behavioral health, shoulder to shoulder with 3 MDs, but to have them go from, I'm not really sure how this behavioral health thing can kind of fit into this, but we're open to it, to you've got to see this patient, you've got to see this patient, you've got to see this patient. Because of my specialty, dealing with stress and trauma and anxiety and so forth, and the specialty treatment of EMDR, we were finding that, and ultimately my study was about looking at biometrics of those patients that were dealing with an anxiety and stress level at clinical levels, and also managing a chronic medical condition, whether it was diabetes, a chronic pain presentation, obesity, so forth. The big 4 really in primary care is what I was looking at, hypertension. So if they had both of those, my population of, I think we wound up with 27 patients who met criteria. We looked at, with a brief course of treatment, what would happen to their biometrics, so what would happen to their blood pressure, pre and post, what would happen to even BMI, what would happen to their A1C score if they were a diabetic, and so forth. And we had an extraordinary result. We kind of knew that was coming because I remember one time one of the MDs coming down the hall and saying, oh my God, look at this A1C score on, we'll call her Jenny, patient Jenny. I can't believe, she's gone from here to here. So we went from, they were like, yeah, we know the stress thing's a factor. I'm not sure exactly how you're going to help us, but we're really open to it, to like, oh my God, look at this. This is a journal article.